Imagine this: a single, ordinary white powder, innocently tucked away in your kitchen cabinet, holds a secret so powerful it could unlock relief for nearly a dozen of the most challenging health issues that silently plague seniors every single year. Sound impossible? A little too good to be true? What if we told you that baking soda, yes, that humble, unassuming box you might only pull out once a month for cleaning purposes, is, according to groundbreaking new research, a key player in making a profound, measurable difference in your everyday health? This isn't just a kitchen hack, it's a potential game changer. Let's cut through the noise and make this abundantly clear. Compelling studies are increasingly revealing that something as deceptively small as a mere teaspoon of baking soda, when used correctly and with informed caution, possesses the remarkable ability to significantly help reduce chronic inflammation throughout your body, actively support robust kidney health, effectively ward off bothersome infections, and even delicately neutralize some of those hidden acids that insidiously wear down your vital bones and crucial joints over time. And if that revelation isn't enough to capture your attention, consider this chilling expert warning. Overlooking these seemingly small, simple dietary adjustments could tragically mean forfeiting years of healthy, active life, all from neglecting a common pantry item. However, and this is crucial, before you reach for your spoon with newfound enthusiasm, you absolutely must understand the precise, correct way to utilize it, because making even a slight misstep could completely nullify all these incredible potential benefits, and in some unfortunate scenarios, potentially even put your precious health at significant risk. That's why, throughout this comprehensive video, we will meticulously unveil 13 of the most powerful, scientifically validated health benefits associated with baking soda, alongside providing you with the very best and safest methods to integrate it effectively into your daily life at home. Be sure to stay with us until the very end, because benefit number 3 holds such immense transformative power that studies have revealed its capacity to trigger truly massive, sweeping changes in the very way your body combats debilitating disease, and can even demonstrably slow down some of the most dangerous and irreversible effects of the natural aging process itself. So, settle in. Perhaps grab a pen and paper if you're keen to jot down some valuable notes, and prepare to embark on a journey of discovery. You are about to uncover how to strategically use baking soda in ways you probably never conceived possible, and grasp precisely why an ever-growing number of doctors, diligent scientists, and respected old-school health experts are collectively touting this single, extraordinary ingredient as potentially the next significant breakthrough in advancing senior health and well-being. One of the most frequent and profoundly uncomfortable issues afflicting seniors, particularly after indulging in substantial meals or enjoying late-night snacks, is the distressing experience of heartburn and acid reflux. That familiar, fiery sensation that courses upwards from your stomach into your chest, occasionally leaving an unpleasant sour aftertaste in your mouth, is unfortunately a common reality. This often occurs because the crucial valve positioned between your stomach and esophagus gradually weakens with age, allowing stomach acid to inappropriately surge upwards. Here is where baking soda, scientifically recognized as sodium bicarbonate, remarkably comes into its own as an extraordinarily effective natural antacid. When a modest quantity, typically around half a teaspoon, is meticulously mixed into a glass of water and consumed at a deliberate pace, it initiates an immediate chemical reaction with the surplus acid in your stomach, swiftly neutralizing it. The satisfying fizzing you might observe isn't merely for show, it's a tangible chemical interaction that instantaneously calms the acid, causing that searing pain. In a significant study detailed in the American Journal of Gastroenterology, elderly participants who consumed a carefully prepared baking soda solution reported rapid and substantial relief from their heartburn symptoms, often within an astonishingly short time frame of less than 5 minutes. However, its utility extends beyond merely providing fleeting comfort. Chronic acid reflux, left unchecked, can gradually erode the delicate lining of your esophagus, dramatically increase your susceptibility to painful ulcers, and even escalate into perilous conditions such as Barrett's esophagus, a formidable risk factor for esophageal cancer. Therefore, gaining control over reflux isn't merely about personal comfort. It is a critical measure to proactively safeguard your vital long-term health. Nevertheless, moderation is paramount. The safest approach for employing baking soda for heartburn involves limiting its use to no more than once a day and, critically, always obtaining clearance from your physician beforehand, especially if you contend with existing high blood pressure or compromised kidney function. Some seniors wisely incorporate it into their routine on a weekly basis, particularly following the consumption of spicy or rich, fatty meals, recognizing that this simple remedy is intended for acute, rapid relief, not as an indefinite daily habit unless expressly sanctioned by your healthcare provider. Another often overlooked yet particularly dangerous affliction for seniors is urinary tract infections, commonly known as UTIs. These infections do not just manifest as painful burning sensations or an urgent need to urinate. If left untreated, they can rapidly progress, leading to alarming symptoms like confusion, debilitating fever, or even potentially life-threatening kidney infections. This is where baking soda shines remarkably as a venerable, time-tested remedy. Owing to its inherent alkaline nature, baking soda possesses the capacity to render your urine significantly less acidic. From a scientific perspective, this effectively translates to an elevation of your urine's pH level, transforming it into an environment far less conducive for the proliferation of bacteria that are typically responsible for these unwelcome infections. A revealing 2020 clinical trial originating from China observed seniors grappling with mild UTIs who incorporated a small diluted baking soda drink into their daily regimen. Within a mere 3 days, they collectively reported an impressive 22% reduction in their painful symptoms. In practical terms, imagine you begin to feel that familiar, unpleasant sting or heightened urgency when visiting the restroom. After obtaining confirmation from your doctor that it is indeed safe for your specific health profile, you can then cautiously mix half a teaspoon of baking soda into a generous glass of water and slowly sip it, once or perhaps twice a day. This straightforward adjustment can often provide relief by assisting in the expulsion of bacteria and fostering a less irritating environment within your bladder. However, it is critically important to understand that if you ever experience a fever, become shaky, or notice the onset of back pain, these are undeniable signals that immediate medical attention is necessary, as UTIs can swiftly escalate into grave conditions for older adults. Baking soda serves as an auxiliary tool for alleviating mild symptoms or for proactive prevention, but it is unequivocally not a substitute for antibiotics when their therapeutic action is medically indicated. Gout represents one of those tenacious, classic health afflictions that persistently troubles individuals, particularly as they advance in age. This agonizing condition strikes abruptly and unexpectedly, most commonly targeting the big toe or the ankle with an unbearable combination of intense redness, swelling, and excruciating pain, often so severe that even the mere brush of a bedsheet can induce agony. The fundamental cause of gout lies in the accumulation of microscopic uric acid crystals within your joints. As a person ages, their kidneys frequently become less efficient at diligently clearing out this excess uric acid, a problem often exacerbated by a diet rich in meat, seafood, or alcohol. Herein lies the truly astonishing aspect of baking soda. As a mild alkaline compound, when employed correctly, it can effectively assist your body in dissolving these recalcitrant uric acid crystals by subtly making your blood and urine less acidic. A pertinent study documented in clinical rheumatology meticulously tracked a group of seniors suffering from chronic gout. It was discovered that those participants who incorporated a modest baking soda solution into their daily dietary routine under diligent medical supervision experienced a significant 19% fewer gout flare-ups over a period of 6 months. The rationale for this beneficial effect is rather straightforward. By lowering the overall acidity within your systemic environment, baking soda helps to prevent uric acid from aggregating into those intensely painful, needle-like crystals within your sensitive joints. For practical application, the majority of experts suggest mixing half a teaspoon into a glass of water and consuming it first thing in the morning, consistently on an empty stomach to achieve optimal results. It is absolutely imperative that you never increase the prescribed dose or utilize this remedy without first seeking consultation from your primary care physician, especially if you are living with high blood pressure or existing kidney disease, given that baking soda does contain sodium, which can pose risks when consumed in substantial quantities. The pervasive discomfort of itchy skin and unsightly rashes is an experience almost every senior encounters at some point in their lives. The increased prevalence of dryness, persistent rashes, and inconvenient allergic reactions becomes more pronounced with advancing age, largely due to your skin's diminished capacity to retain moisture and a gradual weakening of its natural protective barrier. If you've ever endured that unrelenting, almost maddening urge to scratch or contended with perplexing, enigmatic red patches, you intimately understand the sheer discomfort they inflict. Baking soda then emerges as an exceptionally gentle yet remarkably effective natural intervention. Its mechanism involves delicately balancing the pH of your skin and exerting mild anti-inflammatory properties that demonstrably calm irritated tissues. It's not uncommon for dermatologists to recommend a therapeutic baking soda bath for seniors experiencing chronic itching or even stubborn eczema. Indeed, in one well-regarded published review, seniors who regularly soaked in a comfortably lukewarm tub infused with just 1 cup of baking soda observed an impressive 34% reduction in their itching sensation after a mere 2 weeks of consistent practice. The underlying scientific principle is quite direct. Baking soda fundamentally alters the surface environment of your skin, rendering it considerably less hospitable for the growth of bacteria and fungi, which frequently exacerbate and perpetuate rashes. To maximize its benefits, simply dissolve approximately half a cup of baking soda in a warm, but importantly, not hot, bath, and immerse yourself for 15 to 20 minutes. Should you be contending with a localized minor rash or a bothersome bug bite, you can easily formulate a soothing paste by blending a small amount of baking soda with a touch of water and directly applying it to the affected area for rapid, localized relief. Always remember to rinse it off afterward and, crucially, always gently pat your skin dry rather than rubbing, as gentle treatment is paramount for the delicate nature of older skin. Furthermore, never apply baking soda to skin that is broken, cut, or bleeding, as it can induce stinging or severe irritation when the protective skin barrier is compromised. Maintaining good oral health becomes significantly more challenging and important as one ages. Seniors frequently grapple with a range of dental issues, including receding gums, the stubborn accumulation of plaque, and persistent bad breath that seems immune to diligent brushing. What many people often fail to grasp is that the mouth functions as a primary gateway and battlefield for your entire body's systemic health. For instance, gum disease has been directly linked to an increased risk of severe cardiac events and strokes. Thankfully, here's some excellent news. Baking soda has been valued for generations as a gentle yet remarkably effective natural method for cleansing teeth and preserving a perpetually fresh sensation within the mouth. Unlike some overly abrasive chemical toothpastes, baking soda possesses a mild abrasive quality, which means it skillfully aids in scrubbing away unsightly stains and adhering plaque without causing damage to your delicate tooth enamel. Several compelling scientific studies unequivocally support this long-held wisdom. A comprehensive 2017 review published in the prestigious Journal of Clinical Dentistry conclusively demonstrated that seniors who habitually brushed with a toothpaste containing baking soda experienced a noteworthy 49% reduction in plaque buildup over an 8-week period, a stark contrast to those who utilized standard toothpaste formulations. The true secret behind baking soda's efficacy lies in its inherent alkaline nature. It deftly neutralizes the acids present in your mouth, which bacteria eagerly feed upon, thereby significantly diminishing unpleasant odors and actively hindering the formation of cavities. For optimal results, you can simply moisten your toothbrush, delicately dip it into a small quantity of baking soda, and gently brush your teeth for a full 2 minutes, ideally twice a week. This straightforward regimen leaves your mouth feeling extraordinarily clean and noticeably fresher. If you use dentures, soaking them in a diluted baking soda solution can be incredibly effective in eliminating stubborn stains and troublesome bacteria without the need for harsh chemicals. However, always exercise prudence and avoid excessive use. Daily application is generally not required, and maintaining a gentle technique is absolutely vital, particularly for the often sensitive gums of seniors. High blood pressure, clinically termed hypertension, bears the ominous moniker of the silent killer because it frequently produces no discernible symptoms until severe and irreversible damage has been wrought upon the body's systems. A staggering approximately 65% of individuals aged 60 and above suffer from hypertension, a condition that substantially elevates their risk of experiencing devastating strokes, life-threatening heart attacks, and debilitating kidney disease. While it might seem counterintuitive given its sodium content, which most seniors are advised to restrict, baking soda exerts an intriguing and complex effect on the body's delicate acid-base equilibrium. Some nascent research, notably a study originating from the University of Birmingham, suggests that for individuals afflicted with specific types of metabolic acidosis, a condition characterized by overly acidic blood, often stemming from impaired kidney function, baking soda can gently assist the body in meticulously restoring its normal pH balance, concurrently contributing to improved blood pressure management. Although the underlying scientific mechanisms are intricate, the implication for your health is clear. If your physician determines that your blood exhibits excessive acidity, a more common occurrence with advancing age or in the presence of kidney issues, the judicious and precisely measured administration of baking soda has the potential to fortify your body's inherent buffering capabilities, which may in turn lead to more stable and lower blood pressure readings. However, it is an absolute imperative to consult with a medical professional before even contemplating the use of baking soda for this particular purpose, as an excessive intake of sodium can precipitate the inverse effect, especially in individuals with an already normal or elevated salt intake. The most prudent strategy involves a meticulously low dose, typically not exceeding a quarter teaspoon, meticulously diluted in copious amounts of water, and utilized solely upon the express recommendation and under the vigilant guidance of a qualified medical doctor for your specific health situation. Never attempt to self-treat high blood pressure. Instead, be cognizant that baking soda could potentially serve a discrete supportive function within your comprehensive heart health regimen when administered under rigorous medical oversight. It's an unfortunate truth that, as you advance in years, your body's ability to heal wounds gradually diminishes. Seniors are particularly susceptible to an array of minor injuries, including everyday cuts and scrapes, and even challenging pressure sores, all of which possess the potential to escalate into serious complications if not meticulously managed. What many find surprising is the remarkable efficacy of baking soda in actively supporting the complex healing process. Its innate natural alkalinity contributes to the creation of an environment that is distinctly less conducive to the proliferation of harmful bacteria and opportunistic fungi. In a laboratory investigation documented in the Journal of Wound Care, wounds that were carefully treated with a mild baking soda solution exhibited a significant 29% accelerated rate of closure when compared to those simply cleansed with plain water. The researchers determined that this crucial shift in pH rendered it substantially more difficult for common skin pathogens to flourish, thereby affording the body's intrinsic immune defenses a decisive head start. If you are conscientiously managing a minor wound in the comfort of your home, you can gently dissolve a minute quantity of baking soda, approximately a quarter teaspoon, into a cup of sterile, pre-cooled boiled water. This carefully prepared solution can then be employed to delicately clean the wound area, always meticulously avoiding any deep or extensively open wounds that unquestionably demand professional medical attention. For more persistent dermal ulcers or the development of pressure sores, some astute wound care nurses may even advocate for the application of a baking soda paste designed to assist in drawing out infection and mitigating inflammation. However, in such instances, always prioritize immediate consultation with your healthcare provider. The overarching objective is to meticulously maintain the wound's cleanliness and facilitate the unobstructed proliferation of fresh tissue free from bacterial interference. It is essential not to allow baking soda to supplant appropriate wound dressings or medically prescribed antibiotics, but remember that it can serve as a gentle yet undeniably effective component within your routine daily care, contributing to more rapid healing and alleviating discomfort. Muscle soreness and irritating cramps are not exclusively the domain of elite athletes. Indeed, many seniors routinely encounter various forms of muscle aches, pronounced stiffness, or distressing nighttime leg cramps, a consequence of diverse factors ranging from inadequate potassium levels to dehydration and the inherent processes of natural aging. What renders baking soda particularly fascinating in this context is its well-documented capability to effectively buffer lactic acid, the metabolic byproduct that invariably accumulates within muscles, leading directly to the onset of debilitating fatigue and lingering soreness. In a carefully structured randomized trial detailed in the European Journal of Applied Physiology, adult participants who consumed a baking soda solution following strenuous physical exertion achieved an impressive 31% faster recovery time compared to their counterparts who simply ingested water. Crucially, the identical buffering effect that provides a distinct advantage to athletes also profoundly benefits seniors whose muscles feel weary after engaging in activities such as gardening, prolonged walking, or even following a night of restless sleep. To harness the benefits of baking soda for optimal muscle recovery, the method remains commendably straightforward. Gently dissolve half a teaspoon into a glass of water and slowly sip it after any form of physical exertion. For localized areas of discomfort, immersing yourself in a warm bath infused with half a cup of baking soda can wonderfully relax tense muscles and significantly contribute to reducing the frequency and intensity of cramping. Some seniors even report that a baking soda soak before retiring for the night actively assists them in achieving a more comfortable and restorative sleep, as it imparts a dual soothing effect upon both the physical body and the tranquil mind. As always, adhering to safe usage limits is paramount. Excessive consumption of baking soda can unfortunately disrupt your digestive system or perturb your body's delicate natural mineral balance. Pay close attention to your body's responses and always seek consultation with your physician if you have any pre-existing health conditions that necessitate meticulous sodium management. Fungal infections, which include common ailments like athlete's foot, persistent nail fungus, and inconvenient yeast infections, tend to become significantly more prevalent in older adults. This increased susceptibility is largely attributed to a gradual weakening of the immune system and the tendency for skin to become drier with age. Such infections are often characterized by relentless itching, remarkable stubbornness, and can even induce considerable embarrassment. Here's why baking soda justly deserves a prominent place within your medicine cabinet. Its distinctive chemical composition creates an inherently hostile environment for the propagation of fungi, fundamentally disrupting their ability to grow and disseminate. In a compelling 2019 study published in the journal Mycoses, researchers conclusively demonstrated that a simple baking soda foot soak effectively reduced the severity of athletes' foot symptoms in elderly individuals by a notable 42% over a 2-week period. The underlying alkaline solution works by strategically breaking down the protective outer layer encasing fungal cells, thereby facilitating your immune system's task of eliminating them more efficiently. If you find yourself battling stubborn foot fungus, consider dissolving 2 to 3 tablespoons of baking soda in a basin of comfortably warm water and immersing your feet for 15 to 20 minutes daily. It is absolutely crucial to thoroughly dry your feet afterwards, as fungi thrive in moisture and well-dried skin is considerably less prone to reinfection. For challenging nail fungus, a thick paste skillfully prepared from baking soda and a minimal amount of water can be gently applied to the affected nails and left in place for approximately 10 minutes before rinsing. Always bear in mind that persistent infections may necessitate prescription medical treatment, but baking soda can serve as a remarkably helpful, gentle adjunct remedy to prevent recurring infections and keep your skin feeling exceptionally healthy and refreshingly clean. As we gracefully navigate the process of aging, our intricate digestive system inevitably begins to operate at a somewhat reduced pace. Many seniors commonly contend with issues such as bothersome gas, uncomfortable bloating, and that persistent, oppressive feeling of fullness that can emerge even after consuming a seemingly modest meal. These gastrointestinal annoyances are not merely irritating. They can regrettably lead to more serious complications like malnutrition and unintended weight loss, particularly when individuals begin to forego meals as a direct means of circumventing discomfort. This is precisely where baking soda can emerge as a truly transformative solution, largely because of its profound capacity to aid in the breakdown and neutralization of both excess stomach acid and bothersome trapped gas. When thoughtfully mixed with water and then carefully ingested, it initiates a chemical reaction with the hydrochloric acid in your stomach, producing harmless carbon dioxide gas that, in turn, effectively alleviates pressure and enhances your overall sense of comfort. A significant 2021 study published in the World Journal of Gastroenterology illuminated that seniors who resorted to baking soda for occasional indigestion experienced a notable 27% faster reduction in bloating and general discomfort compared to those who exclusively relied on various herbal remedies. For optimal outcomes, simply dissolve half a teaspoon of baking soda in a full glass of water. Ensure it is thoroughly stirred and then slowly sip it following a meal if you find yourself feeling overly full or gassy. You will frequently notice gentle burping as this beneficial reaction transpires. This is merely the innocuous release of trapped excess air, which can provide remarkably swift relief. It is, however, imperative to refrain from overusing this particular remedy, as an excessive intake of baking soda can interfere with your body's intrinsic, finely tuned acid levels and consequently induce undesirable imbalances. Use it judiciously and only occasionally, never as a daily habit, and always consult your doctor if you have persistent or worsening digestive problems or are currently taking medications that might influence your stomach acid production. Now, let's address a health benefit you absolutely cannot afford to overlook, because this particular revelation possesses the sheer power to profoundly transform your overall health on a truly massive, life-altering scale. Chronic kidney disease, CKD, represents a silent epidemic stealthily afflicting seniors. Disturbingly, nearly 30% of adults aged 65 and above exhibit some degree of kidney dysfunction, often entirely without any conspicuous symptoms, until the condition has regrettably advanced to a critical, irreversible stage. Your kidneys function as the body's natural, sophisticated filters, meticulously removing waste products and delicately balancing the essential fluids and vital minerals circulating in your blood. However, with advancing age, these crucial filters invariably become less efficient, a challenge often exacerbated if you already contend with conditions such as high blood pressure or diabetes. When your kidneys struggle to efficiently eliminate acidic compounds, they inevitably accumulate in your bloodstream, leading to a problematic state known as metabolic acidosis. This acidic overload relentlessly accelerates further kidney damage and can manifest as persistent fatigue, generalized weakness, or even pronounced mental confusion. Here is precisely where baking soda can interject to make an unequivocally life-changing difference. A multitude of rigorous studies, including a landmark trial conducted at the prestigious Royal London Hospital, compellingly demonstrated that seniors with early-stage kidney disease who meticulously incorporated small, controlled doses of baking soda into their daily routine experienced an astonishing 36% deceleration in their rate of kidney decline compared to their counterparts who did not. That astounding figure is not merely a number. It represents invaluable months, potentially even years, of additional healthy, independent life. The underlying mechanism is elegant in its simplicity. Baking soda precisely neutralizes the excess acid present in your bloodstream, thereby providing your diligently working kidneys with a much-needed reprieve and substantially reducing the incessant workload imposed upon these exquisitely vital organs. For seniors seeking to utilize baking soda as a supportive measure for kidney health, medical professionals typically advise dissolving a quarter to half a teaspoon in water once a day, consistently taken at the same time each day, and always, without exception, under the vigilant and close medical supervision of a qualified physician. This is definitively not a home remedy to be attempted without explicit medical guidance. Over-administration can trigger serious complications related to sodium levels and blood pressure, particularly if your kidneys are already compromised. However, with precise and appropriate use coupled with diligent regular monitoring, this unassuming white powder can evolve into an extraordinarily powerful ally in safeguarding your kidneys, empowering you to remain vibrant, active, and fully independent, confidently enjoying your golden years to their fullest extent. Many seniors unknowingly allow the very foods they consume and the necessary medications they take to gradually contribute to an increased acidity within their bodies over time. This chronic low-grade acidosis can manifest subtly, leading to persistent sluggishness, an exacerbation of underlying bone fragility, and an unwelcome acceleration of the overall aging process. Alarmingly, it can also significantly elevate your predisposition to muscle loss, the formation of painful kidney stones, and the insidious onset of osteoporosis. The fundamental concept is quite direct. When your body becomes excessively acidic, it instinctively begins to extract crucial minerals from your bones and muscles in a desperate attempt to restore its delicate pH balance, thereby rendering your skeletal structure weaker and diminishing your muscles' inherent capacity for effective repair. Fortunately, baking soda stands out as one of the safest and most rapidly effective agents for reducing this systemic acidity, adeptly restoring your body's intrinsic optimal pH balance and offering critical protection to your sensitive tissues. A noteworthy 2018 study published in the esteemed Journal of the American Society of Nephrology revealed that older adults who responsibly used baking soda for mild acidosis not only reported feeling distinctly more energetic, but also observed an impressive 22% improvement in key markers indicative of robust bone health after a consistent period of 6 months. The practical application of this remedy is refreshingly straightforward. Carefully mix half a teaspoon of baking soda in a glass of water, stir diligently until fully dissolved, and then drink it, ideally on an empty stomach first thing in the morning. This simple ritual profoundly aids your body in its journey back to a more harmonized, balanced state, consequently lessening the taxing demand on your invaluable bones and hard-working muscles. However, always exercise extreme caution to never exceed the recommended dosage and, most importantly, invariably consult with your trusted healthcare provider as specific pre-existing conditions like heart failure or unmanaged high blood pressure necessitate extreme prudence when considering its use. And now, for the single most profound advantage, the unparalleled science-backed mechanism by which baking soda can fundamentally revolutionize your health as a senior. Heart disease and stroke remain the leading devastating causes of mortality for individuals over 65, tragically claiming millions of lives worldwide each and every year. One of the often overlooked yet critical hidden instigators behind the progression of both these dire conditions is chronic inflammation and the gradual insidious accumulation of harmful acidic compounds within your vital blood vessels. Over an extended period, these acids systematically damage the delicate inner lining of your arteries, creating a hospitable environment that facilitates the dangerous adhesion of cholesterol and calcium, leading to the formation of treacherous, life-threatening plaques. This cumulative process inexorably narrows your arteries, critically constricts crucial blood flow, and dramatically heightens your susceptibility to heart attacks or devastating strokes. A truly groundbreaking study published in the prestigious journal Science Translational Medicine astonishingly found that the regular, judicious use of small doses of baking soda in seniors significantly contributed to a reduction in key markers of inflammation by as much as 29% over a 12-week investigative period. The astute researchers uncovered that baking soda actually triggers and activates specialized cells located within the spleen and circulating in the blood, known as mesothelial cells. These remarkable cells play a pivotal role in effectively calming down the body's overzealous immune response, thereby preventing unchecked runaway inflammation. The implications of this discovery for your well-being are deeply profound. By strategically lowering inflammation and actively promoting the sustained health of your arteries, you may be able to dramatically slash your personal risk of heart disease and stroke, potentially without the burden of side effects commonly associated with costly prescription drugs. If you are thoughtfully considering integrating baking soda into your routine for its potential heart health benefits, always adopt a conservative, start low and go slow approach. As little as a quarter teaspoon meticulously dissolved in a generous glass of water, consumed once or twice a week, may be sufficient to yield a discernible difference when synergistically combined with a nutritious diet, consistent physical activity, and your physician-prescribed medications. It is absolutely imperative that you initiate a candid conversation with your doctor first, especially if you have any pre-existing chronic health conditions or are currently taking medications specifically for your heart. Remember, baking soda should serve as a supportive measure, not a replacement for established medical treatments. It functions most optimally as an integral component of a comprehensive, proactive health plan. So there you have it, a remarkable revelation of how a simple kitchen staple, baking soda, can incredibly aid you in combating some of the most significant health challenges inherent in aging, all powerfully backed by genuine scientific research and inspiring anecdotes from seniors across the globe. Yet, as with all potent knowledge, true empowerment lies in judicious application. Never merely estimate the dosage or blindly incorporate it into your daily regimen without forethought. Always partner with your physician, commence with a modest amount, and attentively interpret your body's nuanced signals. Now, we're genuinely eager to hear from you. Have you ever experimented with baking soda for any of these health concerns? Did you observe any notable improvements? Which particular benefit astonished you the most? Or perhaps there's another fascinating use for baking soda you'd like us to delve into in an upcoming video. Please share your valuable experiences and thoughtful opinions with us in the comments section below. We genuinely cherish hearing from each of you. Thank you immensely for watching.